Welcome to this episode of The Talk, brought to you by Dental Protection, specifically for dental hygienists and dental therapists. In this episode, we'll explore why wellbeing matters and why it is so important to take care of ourselves as well as our patients. My name is Claire Stott. I'm a dental hygienist and case manager here at Dental Protection, assisting dentists and many dental care professionals with complaints or regulatory challenges and much, much more. And with that, I know how the workplace can impact our well-being and understand that the demanding nature of our jobs can often and is often overlooked. Health and well-being is a critical issue to consider, and what brings us here now, because it has such a significant impact on the quality of our lives. And I think it's safe to say that COVID has played a part in many colleagues becoming increasingly overwhelmed. It might be that we were having to work in different ways, worrying about health, being on the front line and the health of our patients, and still even now facing a backlog of patients with problems, potentially due to the delays in treatments, which of course then contributes to litigation concerns and harmful habits in a dental surgery that can lead to us becoming susceptible to burnout. And I shall discuss these habits shortly. But with me today is Victoria Wilson. So thank you so much, Victoria, for agreeing to this podcast, because you are very well versed with well-being and mindfulness, and the founder of Smile Revolution. So you are such an inspiration to the profession, and we couldn't have done this podcast without you. So a huge thank you for your participation. I know, Victoria, we've met before, but for those who are not aware of who you are, would you like to briefly introduce yourself?
Absolutely, Claire. Well, thank you so much for inviting me onto the podcast. And it's my absolute pleasure to be speaking to you today on well-being, which is something that is extremely close to my heart as a professional and personally, and how I live my life. So yeah, I'm a dental therapist, and I've been working as a therapist since 2003 when I qualified. I've worked clinically for a number of years up till 2017, when I stepped away clinically to focus on oral health promotion and exploring well-being. I think as a dental professional for years, I was always thinking, as we do when we're treating patients, about many things about our patients. How could maybe we've done something differently, or how could we have improved that, or how could we maybe be reaching our patients to have an even greater impact on their oral health outside of the wonderful work we do in the clinical setting and the extensive work we do there. And we're so dedicated to that. But in 2017, I stepped away to explore this in more depth and focusing on oral health promotion. And now currently under the Smile Revolution, I support other dental professionals to explore different projects within oral health promotion, championing the profession in many different ways, of so many skills that we have additional to clinical that we can embrace and utilize as professionals to promote oral health. So I work with professionals in doing that. But underlying everything, one thing that really is key is our well-being, for us to be really working clinically to our optimal. And also, if we wish to explore oral health promotion, we have to be well. So I support clinicians, a range of clinicians, dentists, dental hygienists, dental therapists, dental nurses, through yoga and meditation, through weekly classes. And this is delivered online through the Smile Revolution, where we explore many, many factors that are triggered, that I'm sure you, Claire, as well, come across daily through our careers, and ways to overcome maybe these challenges that could impact our well-being.
No, definitely. I mean, I've come across the term like burnout. I think that's becoming
increasingly recognised across healthcare, and it encompasses chronic workplace stress. And that's when it's not being, successfully managed. How, Victoria, with Smile Revolution, how can members reach out to you or anyone that's listening? Because I think it's important to try and get this well-being culture embedded within like dentistry.
Yeah, absolutely. Well, you can reach out to me through the website, which is www.smile-revolution.net. I'm on Facebook, I'm on Instagram, or even calling me. I am more than happy to receive calls and messages from colleagues, and I frequently do one-on-one, and all my details are accessible on the website. But I agree with what you were saying, Claire. I guess it needs to become, and what we're looking always into is, how can it become a culture within our personal and professional life, this focus of well-being, so it's fused within what we do on a daily basis.
Yeah, I mean, I don't know if anyone read, but I think it was May 2019, and the World Health Organization, so WHO, they included burnout in its
Yeah.
11th revision of the International Classification of Diseases as an occupation phenomenon. So it's not classified as a medical condition as such, but it is referred in the occupational context. So I think it's important we can, to try and look at ways of how we can, concentrate on our well-being. I know, like you mentioned, Victoria, whether I've experienced, concerns or burnout as of you, but I do hear many hygienists and therapists who might have like lost a supportive boss. They might have retired,
Yeah.
contracts have changed in their hours, the appointment times, and the workload increases beyond a sustainable point. And it's the total environment. It just becomes so overwhelming that it's sad to hear that, they're thinking about quitting work or changing roles. And many were self-employed as well, so time off work is often the last resort, and sometimes time away from work is needed to recuperate. Have you heard of halt at all, Victoria, the halt method? Is that because it was something I first became aware of listening to a consultant. I can't remember his name, but he's a sleep medicine consultant at the Guy's
Right.
and St. Thomas Hospital, and it refers to, halt, take a break, step back, and actually ask yourself, are you feeling hungry, angry, lonely, or tired? And it's simple enough, but I think we are susceptible to potentially self-destruction behaviors if these basic needs are not met. Have you seen any trends at all, Victoria, giving rise to increased anxieties?
I mean, certainly within the
Mm,
range of burnout, I know one of,
mm,
of treatments is actually stepping away from work. And I think where I can really tap into this in my capacity is that need for you to listen and understand your body. And we are, and this very much ties in to what you're describing here as the Holt method. We have so many things to focus our mind on, and specifically a trait that I see commonly, going back to what you're saying in the dental profession, is that perfectionism, that commitment to strive to deliver exceptionally, and also, and we put such high expectations on ourselves for our patients to continuously want to deliver the highest standard of care. And also that's of course with what we are required to do. And we've got so much consuming our mind that what seems to happen is there is a disconnect with us listening actually to our bodies. And we override this. One example that we focused on in a class today actually was that connection with our hands. As dental professionals, our hands lead our work. But how often do we actually connect with the touch of moving the light, putting the gloves on, how the instruments feel on our hands? And we are on autopilot because we are doing things again and again that actually just pausing to take a note and a moment to appreciate our hands and be thankful. Gratitude and compassion is a huge area of a lot of evidence that supports well-being. Actually taking a moment to stop, to pause within our workflow and acknowledge what our hands do for us, our patients, every day, and actually feel the touch. So going back to Halt, it allows us to listen to our body. And that's one thing I think, as talking about well-being, championing that more and taking just a moment to connect with our body, listen to our body if we're hungry, if we're tired, if something's bothered us, so that we can help to eliminate this burnout or reduce the risk. We're focusing on prevention ways, but we're in healthcare. How can we prevent that on us ourselves?
Yeah, I agree. And I suppose it doesn't have to be like a physical need if you're hungry. It could be an emotional need as well. So not only for eating enough and the right things at the right time, but are you hungry for affection or validation? You know, especially if you're in a practice,
Absolutely.
yeah, that's not supportive. And again, you know, on that, I mean, I think I can honestly say I have never had my full lunch break throughout all the practices I've worked at. I have never ever taken my full lunch. I used to get there, you know, the first person there on the morning, you know, to read through all the patient records. Didn't really have that much support. So, of course, you know, when it comes to break time, I'd be doing my instruments, catching up on my note taking, and then I'd be the last person there to leave. And I think many of my colleagues would probably agree, you know, that there's very little time, you know, for breaks, which that's why the consultant in sleep medicine resonated with me, because he said breaks for staff are not a luxury. You know, that they're a necessity. But of course, it doesn't always, you know, happen like that in practice. So it's trying to look at other ways to perhaps try and help and get ourselves motivated. Are there any tips that you can share, Victoria, in terms of, you know, for example, if we are in the surgery and we're having a stressful moment? You know, I've been in a situation where I've become quite tearful because it's just been a horrendous practice I've been working at. But how can we overcome that? What is it? Is there any tips that you can share?
I think it's having those resources at at your fingertips to be able to infuse that well-being of when there is a trigger, identifying that there is a need for something. Something I go back to again and again is just pausing and just finding your breath and breathing and just pausing. It may be for 30 seconds. It may be for a minute if you can, but cumulatively throughout the day, if you can just pause, just to be present and find what it is to be present in that moment when you're breathing. That's one thing I think that can help. And also being honest with ourselves, understanding why we're feeling like how we are feeling. And a focus that I will go back to again and again through my work is finding solutions. If we are feeling tense, maybe it's cross infection, not having the time to complete everything in sterilization that we wanted, so we couldn't get a lunch break, knowing when we can speak up. There is a need, because we need to maintain this balance for our well-being. And if anything is a trigger to align us or take us away from that alignment, we need to find that solution to realign, to maintain that equilibrium. So if anything's pulling us away, and at any point being honest with ourselves and understanding what it is, and working with our teams to find those solutions to support our well-being, which is needed for every one of us.
Yep. I think a lot of it might come with confidence as well. I know when I first started out, I didn't really have much confidence in myself to perhaps, you know, speak up Whereas, of
Absolutely.
course, nowadays it would be totally different. I'd make sure, anything that was on my mind, I would get across. But
Yeah.
it can feel lonely as well. And I think
Oh,
it's
no.
important to have somebody to reach out to, whether it's yourself, Victoria, whether it's us at, Dental Protection. But I spoke to a lady not so long ago at one of the regional study groups, and she joined the study group because she'd moved to an area with her partner. All her colleagues she trained with, were miles away, and she felt on her own. So just something like that, reaching out to the regional study groups is probably quite helpful, just to get, because it's nice to share. You're speaking to like-minded individuals that are going through the same experiences as you, and it's just nice to get that off your chest sometimes as well.
I think that's so important as well. And yeah, our connections, our peers are key, because it can be so isolating. And I know that's something that's expressed regularly from the profession. Sometimes when we're working on our own, if we're not fortunate enough to have a dental nurse, or we're not working with other hygienists and therapists in clinics, we may not see another hygienist or therapist colleague for, many months sometimes.
Yeah.
And you need those connections, because you also realize it's not just you feeling that. So yeah, I couldn't agree more. Reaching out, and also networks that, when you don't have that confidence, it may be early in your career, mid-term, or even what we've been going through over the last years. Things have changed so much, and our confidence has been impacted, understandably. And I know this is the case speaking to many colleagues. So also recognizing what resources can support building that confidence. Maybe it is for you joining that network group. But going back to that honesty of being honest, what's for you, because it's also different for everybody what we feel we need to maintain that equilibrium, that balance. So reaching out to explore also what's available. I know Dental Protection, have resources as well, and there are more and more resources now available to us, and understanding what works for you.
Yeah, we just on that, we introduced a take a break culture, and it was embedded into our practices. What it wasn't by myself, it was a lady hygienist who since retired now. And then when I took over, I remember the practice manager saying to me, "Oh, there was just a 15-minute break in the morning and a 15-minute break in the afternoon." And she said, "We can remove that for you if you wanted." And I was like, "No way, this is amazing." It's only 15 minutes, but that 15 minutes, it made a whole lot of difference. So it could be that, a practice might be willing to perhaps implement short breaks, within the diary. But you are right, Victoria, we do have members with dental protection. They're entitled to contact our counselling service as part of their indemnity with ourselves. We have resources via our Prism, which is an e-learning platform, and there's burnout courses on there as well. Of course, if you phone the Dental Protection Advice Line, you might get to speak with myself or any of my other colleagues, and the counselling service is available 24/7. But like the regional groups, if you're a member of the British Association of Dental Therapists, the BADT or the BSDHT, they'll have the regional study group days. And also, Victoria, I think you might be attending the Wellbeing Day in May with the British Society of Dental Hygiene and Therapists. So that might be something, if anybody's listening who perhaps wants to come along, might be something you might want to do. And I think you're speaking, are you, Victoria?
I am
The
speaking. Yes, it's just something really for everybody to have at the forefront of their mind, their well-being, and making that a priority, because we are the only ones that can.
I think we're all sharing the same vision. We don't want you to be on your own, and you're not on your own. Just a telephone call or an email, reach out, because we wouldn't want you to be in a situation where you're feeling isolated and not, supportive, because we have been there and we know exactly what you're going through.
Absolutely. And yeah, I just invite people to reach out anytime that you feel you need to. And I think it's certainly more acceptable now than ever to be talking about our well-being, and that gives us, I think, as a profession, assurance that we must speak out about it. It is okay to, and we can.
Thank you, Victoria. And if you're willing, hopefully we can end this podcast on a short, brief meditation session, which is specifically dedicated to our dental hygienist and dental therapist colleagues. Thank you again, Victoria.
Thank you very much. So for all of you listening, if you would like to just find a comfortable place to sit, this can be on the floor with your legs crossed, or sitting on a chair with your feet grounded on the floor, comfortably sitting, to take a moment to begin to find your breath. I'd invite you to begin to breathe in through your nose and back out through your nose. In and out. Now, if you'd like to close your eyes, to allow your focus to be drawn into the flow of your breath, in and out. You're so still, so quiet, simply breathing, and so present. Now, if you can take your mind with your eyes still closed, still focusing on your breath, to imagine you're sitting on the sand, on a beach, with the warm sun beaming down on your skin. You feel the warm sun on your skin that begins to filter through your skin, and this beautiful warmth flowing round your body. The sun, the air around you. You can hear the waves crashing in on the sand. And you continue to feel the warmth filtering through your skin, and this beautiful feeling of warmth flowing round your body. You're so present, just enjoying merely sitting, still, breathing. So at ease, so utterly relaxed. And this beautiful warmth that's flowing around your body is such a positive energy you feel. You notice it. You notice how you feel. As you continue to sit so still and quiet, you see with your eyes still closed in your mind, the waves coming in and out. This wonderful feeling that you feel, so still, so quiet, so present, where you feel the sun, you see the waves, you feel and hear the air around you, is such a beautiful, calming feeling. And now, with all this feeling you feel now, imagine the beginning of your day ahead, where you enter your clinic, still feeling this beautiful feeling of calmness, of being present, so present. You walk in through the door of your clinic. You notice your colleagues. Yet this feeling that you've manifested on the beach accompanies you throughout your day. As you go into your clinic, you've set up your clinic for the day in your surgery, and still everything you feel accompanies you in everything you do. Your day continues. You welcome your patients in, and still this beautiful feeling accompanies you throughout your day. As the end of your day draws in, as you come to the end of your day at work, you leave your clinical setting still feeling as you felt at the beginning of your day. As you return to this wonderful setting on the beach with the sand underneath your skin, the warmth on your skin, the waves coming in and out. So present, so quiet, still hearing your breath flowing in through your nose and back out through your nose. As you gently open your eyes, as you awaken from this short meditation dedicated for you, dental hygienists and dental therapists, to manifest a feeling of being present, calm, noticing so many things and allowing this beautiful calmness and warmth within and positive energy to accompany you through every day. And I finish the meditation with you now.